My name is Dr. Chinelo Animalo, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.
What is the prevalence in our community? You know, people just don't talk about it like they did before medicines, came on the scene.
So we have a major issue at the moment. So Memphis, our dear city, ranks number 2 in the entire country for the most newly diagnosed cases of HIV. And what is shocking is that it's affecting our younger populations, our teenagers from the range of 14 years old to 19 up until 21 years old. So it is scary and it is devastating.
Okay, 14 years old. So where is this coming from? Because the only way, in my generation, we always connected it with, intimacy.
Absolutely.
So how are 14-year-olds in that age group contracting HIV?
Exactly. So we all wonder about that. But what this is telling us, obviously, because the numbers don't lie, is that our younger ones are having what we call unprotected sexual intercourse.
Okay.
I mean, there are many ways you can, pick up HIV. Number one would be through intimacy, unprotected sexual intercourse. You can have other sources like blood transfusion, but these days, blood products undergo very rigorous testing before they are transfused. And then you have what we call like vertical transmission, where a mother who has HIV that was uncontrolled and gives birth to a baby and can transmit that infection to the baby. Then for the healthcare workers, you can have like what we call the needle stick injuries, where you get a needle stick from maybe an infected person. And then another population would be our intravenous drug users. So if you're sharing needles, or people that perhaps have to take, let's say, insulin or whatever, and you're sharing needles with people. So those would be the major ways of transmitting HIV. But in our teenage population here, it's pointing more towards unprotected sexual intercourse. My name is Dr. Chinelo Animalo, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.